Now we are scanning the pelvis by using convex probe. Here we see the urinary bladder, which is partially filled. Now we slightly sliding the probe above the urinary bladder to locate the small intestine. Here we see the gases in the distal ileum. Now we slowly sliding the probe to the right iliac region to locate the ileocecal junction or cecum. Here we see the heterogeneous area. This is cecum. The walls of cecums are markedly inflamed and thickened. The surrounding tissue around the cecum are also echogenic and inflamed. Now we will point out the appendix by slowly tilting the probe up and down side around the cecum. These are the folds of cecum which are markedly inflamed. No free fluid or collection seen around the cecum. Here we see another heterogeneous area at the left lateral side of the cecum. Now we will search this area by rotating the probe at its axis at left lateral side. Here we see irregular wall lumen. This is appendix and surrounded by the echogenic inflamed tissues. This is the blind end of appendix. Now we will measure the anterior posterior diameter of the appendix. The appendix is inflamed and its anterior posterior diameter is 13.7 millimeter. The normal diameter of appendix is up to 6 millimeter. No free fluid or collection seen around the appendix or peripendicular area. Here we see the ascending colon, which contain gases. The walls of ascending colon are not visualized as they are normal. Now how we will write report.